Welcome to the Choosing Happiness podcast with me, your host, Rudrani Devi, the Happiness Lady. In these conversations, we will be discussing an uncommon way to find joy in your life with weekly special guests. Did you know you could choose your happy? Won't you come and play and discover how these magical tools could work for you? Let's do this. Well, howdy from Nashville, y'all. Rudrani Devi, the Happiness Lady. That's right. You got me again. And I'm thrilled beyond belief for my next podcast guest, who, I like to say saved my life. Because what I was going through in my journey of trying to find balance and all this stuff, I knew I couldn't function that way. Now, some of you know, I'll just give you a really quick backstory, that I was in India and got hurt. There was a terrorist attack and I got shot by terrorists. I'm brushing over it because you guys can Google it. And I really want to get to Dr. Deering. So needless to say, much later down the pike, when I decided to get off of lots of over-the-counter meds, mainly, other than birth control or whatever, I started having symptoms, and I was actually told to go see this dude. And amazing, functional neurologist, chiropractor. And I want to speak a little bit about him before I actually have him speak. Okay, so let me get my big girl glasses on here. For those of you that are smart enough to be watching on YouTube. Okay. Dr. Justin Deering, y'all, has provided chiropractic care in the Franklin area since 2011. Now, Franklin is right down the road from Nashville, Tennessee. So he's about a 20-minute drive from me. In 2014, he achieved Diplomate credentials in functional neurology. I love it, Diplomate. At Deering Chiropractic Neurology, our mission, I'm reading right from this little thing here, is to identify underlying neurological issues and implement a specialized treatment protocol, improve function of the brain and neuromuscular system. Dr. Deering's passion, and I can vouch for this, y'all, because this guy works himself to death, I'm just saying, is helping his patients achieve optimal physical function, brain function, and improving their quality of life. And that's that headspace I was in because I was not having quality of life. I had no idea that when I got off all of this stuff, that all these symptoms were going to start showing up. But before I get into all of that, hello, Dr. Deering. Thank you so much for agreeing, Dr. Justin Deering, Dr. D, for agreeing to be on the podcast.
It's my pleasure. Thank you for having me.
Yay. Do you want to tell the folks a little bit more about what you do? Because what I said is probably Greek to them.
Yes. So my background has always been in natural medicine of all sorts. So my career began as a chiropractor. Soon after graduating and starting to practice, I got into acupuncture, herbal medicine, nutrition. I wanted to know how to get to the root of every problem that came through my door. So that ultimately led me down the road for the Diplomate in neurology. It helped me to understand things like movement disorders, which is part of what your scenario was when you presented to us.
Part.
The
worst part.
Yeah, and so functional neurology is sort of what it's known as. So we use the understanding and the knowledge of how the brain works and how the body is coordinated by the brain to essentially get the nervous system to balance, right? So in your scenario, if we took a Chinese medicine approach, you came off medications, you were traumatized significantly, and so your nervous system did not feel safe and connected, and all of these things that we take for granted every day. Chinese medicine would call that a windy condition. You were dizzy. You had vertigo, obviously.
Oh my God.
And that
just 1 second, y'all. I didn't just have vertigo. I just want to explain to my listeners. I would try to get out of bed and would be holding on to the bed because the room was spinning so hard. I'm even amazed that I was able to get into my car to get to my savior here, because it was like the worst. And it wasn't hungry because of the dizziness. You know, how does you feel nauseous and all the things? But I just wanted to do a really quick timeout because it wasn't just I was a little dizzy. Let's be truthful here.
Yeah, you were very dizzy.
I was so dizzy. The pictures in your office were even dancing.
Right.
If you recall.
And that's the dizziness and vertigo in general. You had a mix of different types of dizziness, essentially because the nervous system was basically disconnected from its gravity receptors. And if we can't, get all the information from our feet and from our spine and from our body, and especially our neck and cervical spine, then we're going to have a hard time calculating where we're at in space. And so you throw on top of that some brainstem stress and maybe an injury, a little head injury. You might have whacked your head on a cabinet that set it off, and who knows where that came from. But I usually see chronic dizziness after head injuries. It can be 5 years later, and we turn our head too fast in the car, and we tweak the neck, and that's the last straw. And here we are, we're chronically dizzy for years before you make it to somebody who can treat the underlying condition, which requires functional neurology, essentially to go through rehabilitation processes for all the systems involved. So dizziness in general involves the neck, the inner ear, and the eyes, and their central calculation, which happens in the brainstem. Can often get disconnected for a number of reasons, whether that's inflammation in the brain from COVID or any other type of pathogen or virus. So there's just a mixture of systems involved. And so we see that in lots of other conditions as well. No matter what the problem is, it involves one of what we know and operate with at the Deering Clinic, which is the 4 pillars of health. Essentially comes down to blood. What's the quality of your blood? What's the chemistry like? Is it balanced? Are you delivering blood flow to those neurons in your brainstem? And then we have your bones, your structure, essentially your skeletal system, and how well that's feeding back to the brain and the nervous system to tell you where you're at in space. And then you have your muscles, which is the 3rd pillar. Your muscles also provide that feedback. They provide good circulation for your body, growth hormones, all kinds of stuff that happens when we use our muscles every day. And then the 4th pillar is your mind, right? And so where was your mind, at that moment in time you were terrified of your
Absolutely. And there was this, I'm curious to know, because now when you say the mind, I recall how much I had this short-term memory loss and some stuttering going on as well, because I couldn't, and a lot of times I couldn't even find words. I remember being home for the holidays, and I called the washer and dryer, the dishwasher, because I just couldn't get the words. So what's going on in the brain when you can't even find the words you're looking for, or you've just told somebody something and then you repeat it? Because I went to meet a friend for lunch, and I hadn't told her what was going on with me. And I asked for extra sliced tomatoes on my burger 3 times. Yeah. And she finally put her hand on my knee, and she was like, "Honey, you've asked the waitress 3 times for extra tomatoes." And the funny part was I didn't get my extra tomatoes, but I do remember that. But what is going on with the brain when that kind of oddity happens? You think you're losing your mind.
For sure.
I know I did.
So that's one of my favorite concepts there in neurology is understanding how that works. Your cervical spine has a lot to do with dizziness, number one. If your cervical spine is locked down, your brain is dizzy. It will automatically lock down musculature so that you don't move and that you stay in the bed so that you don't fall on your face. That's the brain's sort of safety mechanism in that scenario. But the cervical spine stimulates a number of coordinators in the brain, basically every part of the brain. But there's one really interesting part of the brain that lies in your temporal lobe, which deals with memory, word formation, but it is very critical in the transfer of what just happened and putting that into short-term memory. This particular portion of the cortex is critical for that, and it is highly linked to the cervical spine. And if the cervical spine is not stimulating this area to tell you where you're at in space and time, essentially, then we get a disconnection there. And if things aren't stimulated, then they don't wire together to the other areas that they operate with in conjunction. So you end up with maybe not knowing where you're at in space or time, and that affects memory. And so
thank God for sticky notes, Dr. Deering, because I would have to put on the dash of my car, where am I going at what time? And that was another thing. Even before the symptoms were notable, before I'd actually done the homeopathic route, she was actually the one that sent me to you. I would show up for like yoga classes or Pilates classes an hour early or on the wrong day. And it was happening a lot, to the point where people were like, "Are you overworking? Are you stressed?" And this is before I was seeking you out and had all the dizziness. So there were signs.
Yeah.
I just wasn't paying attention. I just thought I was getting old or crazy or something, or senile.
It can make you feel like that, but you know that when if you're feeling in general, somebody's sad or depressed or not doing well in general, the memory starts to go. I feel brain fog. All these things come in, and as soon as that person begins to exercise and to move and to use their body, that stimulation comes back to the brain, and the person feels brighter. They feel happier, more engaged, less brain fog. And so just using our body the way it was meant to be used and experiencing the full range of motion of every joint and every muscle and tendon in our body optimally stimulates the brain. And so if you have a neck problem and you have an arm that jerks with a little movement disorder because of trauma, because of medications, because of a number of things, then we're going to be constantly bombarding this neck with stress. And so if those muscles lock down because of that stress, then we don't get the full experience of our cervical spine motion, and that really wrecks your ability to form memories, to feel good, to have coordinated thoughts and coordinated words. So there's a portion of our coordinator that helps us to learn to catch a ball and never forget. How to do that.
Right.
That
Like playing violin. I started playing violin at age 3.
Exactly.
And even if I don't touch it for I'll say months, I can go back to it, and within a couple of weeks, I can relearn or remember pieces that I had memorized as a child.
Right.
But I found myself not remembering what I had eaten for lunch, and it was dinner time.
Sure. Yeah.
I started actually logging things to remember what I did, and I had a sticky note to remind me to brush my teeth in the morning at one point.
Yes.
Which is a weird.
It's going to happen.
Have you ever heard of that before?
Oh, yes. Yes. Lots and lots of wild scenarios can happen with the brain and the nervous system when stress is all around in the body, in the neck, in the brain. And so ultimately your fight or flight mechanism kicks in, and the stress, kind of drives you to not do much and not be stimulated and not really be able to take care of yourself. And so we have to come in to those folks' lives when they walk in our door and let them know that, hey, you're in the right place. We understand what's happening here. Show you what's going on. We measure it. We show you the problems with the eye movements. We put the goggles on you and measure how fast your eyes move, how accurately they move to targets. That tells us everything we need to know about where the problem is in the brainstem. So then we go after stimulating that particular area. So if your problem with word finding was because of your right cerebellum and your cervical spine coordinator, then we go to stimulate that cerebellum. We do that with a number of modalities. We start with first by calming you down and telling you that everything's going to be okay. We just have to work on this. And you're muted, by the way, if you didn't know that. So you got it.
He would do this little thumb thing, y'all. Where he had put a little face on his thumb and had me follow his thumb with my eyes. For those of you that aren't watching on YouTube, you're really missing out. I'm sorry, I got a little frog in my throat. And so I was like trying to follow it. And even with the hand-eye coordination thing, where in the beginning it would take me so long to finish the light series. And then within like 2 months, I was able to knock it out in like a minute.
Yeah.
Yeah. There were so many different things, but I do remember the first time I came in, you weren't the first person I saw. I saw somebody else who then brought you in, and you should have seen the look on your face when you hit my knee with a little thing and my leg went flying and my other arm went flying. And you said, well, that's interesting. You were so calm. You didn't tell me until much later how entertaining that was for you.
Yeah.
And that it was a little extreme.
Yes, it
was the words you used. And I also remember you saying something. I've never, down the road after we got to know each other better, I've never seen someone with such a brain injury that's able to function so well in the world.
Right.
And I don't take anything, y'all. I might take an Advil 2 or 3 times a year. Yeah. That's about it. Yeah. Anyway, I didn't mean to interrupt, but
No.
I mean, what did you think when you first saw me when I first walked in?
Yeah, well, I said this is the worst movement disorder and injury that I've come across in my career since I started practicing functional neurology. And I'd seen loads of concussions with major problems, and worked to fix them all up. But watching that particular reflex, if I tap your knee reflex and your patellar reflex, and that spills over in your spinal cord to make your arm jerk and move up into the air, then I know we have a major spinal cord regulation problem, and that it's not like a lesion on your spinal cord. You didn't have lesions on your brain or anything else like that. It was truly a functional deficit, we'll say, where things just aren't connected well. And so our approach in functional neurology and any type of rehab that we do is to find the problem and give it the three things that it needs to survive and then eventually thrive, like you are now. And those three main things are oxygen. We have to get oxygen there, which means we have to have blood flow, and we have to be breathing well. Then we have to have good nutrients, which means good blood flow. And then we have to have stimulation. And that's what keeps neurons alive our whole life. And if you injure something and it doesn't immediately reconnect, let's say after a concussion, you shear your brainstem a little bit and you disrupt some pathways, then we'll have problems for a period of time. Usually most people will recover within a week or two. If it's a normal injury, it's their first concussion or whatever the scenario is. And
a week or two.
It's the third concussion where that inflammation just sticks around and just continues beating up those neuronal pathways. And so then our job is to try to pull down the inflammation, which is what we did in your case with herbs back then. I did a lot of herbal medicine.
A lot of herbs, a lot of acupuncture.
A lot of acupuncture. So we take acupuncture and we stimulate the nerves. Acupuncture stimulates not only the nerve physically, but it also chemically stimulates that nerve to bring growth factors and mobilize nutrients for your brain. And when I place a needle in the windy dizzy point in the back of the scalp and the skull, where the neck meets the skull, this stimulates a whole pathway of things through your right cerebellum, through your spinal cord, up into your brain on the left side, where your left brain senses this movement and motion, and that sensory area connects with the motor maps of how to move it. It connects with your frontal lobe, how to process, that movement. And so we're just stimulating those networks to reconnect, essentially. So we want to dilate blood vessels. We can do that with acupuncture. We can do that with laser therapy. We can do that by putting a demand on the muscle.
Right, we did that as well.
Yeah.
I want to share something though with the listeners, because I remember the first time you started doing acupuncture, I would get what I would call brain shakes. And you'd given me some exercises. For those of you, you're really going to have to jump over to YouTube if you guys are listening on Spotify or Apple or something, but where I had to move my wrist or whatever. And I still use that to this day when I start to feel them happening, or I use the eye functioning things where I'm looking at one spot away and then one spot closer. Because you gave me a lot of eye exercises. The thing is you would be doing this and I'd say, oh, I feel that going down my leg. And you go, well, yeah, that's the pathway that goes to blah, blah, blah. And then I'd say, oh, and now I'm feeling it over here. I'm getting a warm spot here. Oh, my brain's shaking. And then you started giving me visualizations.
Yes.
Which helped a lot.
Yes.
Like, being on a mountaintop or watching a willow tree, the wind blowing. And I found that I could so easily go there. For me, it's like expanding out and including everything and excluding nothing, so that you're a drop and the ocean. You're not in your head doing this. You're in this expanded space. Was that something that you just knew to do on your own, or was it something that was taught to you? I mean, I know you studied. Didn't you study in Brazil for a while also? And
Sure.
Before you came
in Chile,
was that just something that came to you, or?
Well, that was maybe a happy coincidence at that particular time. But understanding that even deeper all these years later is to know that when I think of something, let's say the willow tree that we talked about, go to this mountaintop place and visualize this scene in your mind. Number one, it occupies your brain so that you're not living in the stress space for the moment. But it activates your frontal lobe. The only thing active when you're visualizing is your frontal lobe. That's your executive center, the thing that makes you human. And when we have brainstem problems, especially associated with severe stress, then I need something to trickle down onto that brainstem to give it gentle activation without me coming in and doing a bunch of arm movements or neck manipulation or anything like that that might be too strong for your nervous system, that would kind of complicate our progress if we went too far too fast. The visualization is huge, and that was probably our first step, if I recall.
Yeah, we had to start with it because everything stimulated me to the point where, well, you remember the time that you'd put some needles in me. I know I'm jumping all over the place. This is my ADD that I don't take anything for, y'all. Where my body was kind of going a little nuts, and I had finally gotten to the space of allowing my body to let go of all this stuff that was, unwinding is what I call it, where there was so much caught up in my body that wanted to be let loose from the stress and maybe from what had happened in India or my childhood with the abuse as a child. All those things were finally coming up to the surface, and I finally allowed it to go. And I remember you came in one time and I was hanging halfway off the table. And this is what I love about your dry humor. You were like, "Oh, that's how you ended up." And I'm like, yeah. And you were like, "Well, I'll be back to adjust you in about 15 minutes. And I'm like, "Could you help me get back up on the table first?"
Yeah, yeah.
Do you remember that?
I don't recall that particular.
You don't remember?
But yes, that happens when your body shakes and moves like that. That's very, very much associated with a traumatic history.
I was thinking I should be in a padded room because y'all almost fell off this table a couple of times. Yeah. I was like,
back in the old days when they first started studying neurology, they would have called that hysteria, and you would have been put in a straitjacket. But understanding where that is coming from allows us to be able to operate to treat it, so that we can stimulate the things that need to be stimulated, reconnect the system so that you can be better grounded. Right? Mm-hmm. So when you're in your best state in life, you're connected. You have the social engagement. You're outward in your seeking of companionship and friendship and all these different things. But the moment that stress comes in, you rise up into a little bit of fight or flight mode. You start to get a little anxious. You get a little panicky. Maybe you resolve the situation. You come back down to this, lower level, social engagement, safety and connection and all of that. Right. And, digestion is good in that state. Your immune system's good in that state. But the moment we get up into that fight or flight state and we get higher and higher and higher, well, if there's a tiger that is staring me in the face, then I'm probably just going to freeze. So I go into that freeze mode. Right, and your body was teetering between the fight or flight and the freeze mode, and the stress and the trauma and the history all lends itself towards the emotional system spilling over into the motor system, and that's what creates this vibration that you feel in your chest if you're panicky or if you've had.
So if you're trying to suppress those emotions, what tends to happen? Because, I know a lot of people, that have like panic attacks and they're out. Because I work with a lot of clients too that have a lot of the same issues, and they don't want people to see that they're panicky. So they try to suppress it. Like for me, when my body wanted to jolt around, I would sit on my hands, I didn't want people to see that.
Right. Yeah. So, of course that's uncomfortable if you don't know, what's going on with you, and you're outwardly shaking or, having movements, or your chest is tightening up because you're having a panic attack in a social environment that you're not comfortable with, or just whatever scale that's on. The nervous system will want you to flee, right, from that situation, and so that's the fight or flight. Right, I'm fighting it because I'm trying to be here in this social environment, but I know that I have panic attacks when I'm in a social environment like this, but I'm fighting to try to be here, but my body is wanting to flee. That's this regulation of the nervous system depends on an automatic system in the body, which is our autonomic nervous system. It's the thing running in the background all the time. But the autonomic state, if I'm not relaxed in a sort of rest and digest mode, then I'm in a sympathetic, aroused state. And so the inability to get yourself out of that aroused state back down to a relaxed state in an environment where you shouldn't necessarily be threatened, then your nervous system will teeter-totter back and forth between this fight or flight and freeze. And so that ultimately, gets reflected in the spilling over into the motor system, where we get the shaking thing that happens. So
Gotcha.
it's complicated.
Well, I know. It's fascinating actually to me. I know that I had some grafting done, some gum grafting done, and you stay awake, and they numb your mouth, they numb your gums. The doctor, the nurses, and then you watch them with a needle and thread or whatever it is, and they're stitching in or grafting in cadaver gums. I know this is very exciting, but I felt my body starting to get uptight. And, I talk to my body all the time. I'm like, good job, body. It's going to be okay. This is actually, it's something that's going to actually help us so we don't lose our teeth, all the things.
Right.
I mean, I'm so obsessed with my teeth, y'all, that I've had braces 3 times and now 4 Invisalign because the gum grafting actually made all my teeth move again. Wish I had known that. Anyway, beforehand, I digress. But what I did was I was with one hand petting my leg to let my body know that I was there for it, even though it was me touching my body. This is also my body, my hand. And I was doing this exercise you had given me
Nice.
to do. And I was looking at the doctor's nose, and then I was looking at the wall behind him, and I was looking at his nose.
Right.
That thumb exercise,
Exactly.
My nose, get over here,
Yeah.
over here. And he said, "What are you doing?" And I said, I'm getting my body settled.
Yeah.
This will simmer my body down. Because he said, yeah, you seem a little, I said, I'm not actually nervous. I was excited to get this work done, but my body, is that the disconnect you were talking about? Because my body was just automatically going into this thing. And I'm going, wait a minute, he is not stitching our mouth shut. This is going to be okay.
Yeah. So there's probably a number of mechanisms happening there, but, you're in this place where you can't move because you have to do this procedure. And your brain is saying, well, this is kind of odd. It might be painful at some point if he, hits the nerve.
It kept wearing off, which he had to keep injecting me. And he said to me, this is not normal. He had to give me the local like 3 or 4 times during the surgery.
Right. Well, hearing not normal and knowing that pain is probably coming if this thing wears off fast produces a little bit of fear. But then you also have this observation of the stitching happening, and it's going away from you and coming back close to you and going away from you. The reason that we do some of those exercises where you go near far is to help your upper brainstem, which deals with your arousal and stress response and all of that, is to stimulate it. Because if I take my thumb and you're really wound up, if we would have done this test on your first day, I purposely didn't do that so that we don't, wind up your nervous system more.
Yeah.
But if you're just saying, I got brain fog and I hit my head and all this, but you don't know where your stress or emotions or whatever's coming from, and I see how your eyes move and I take my thumb closer to your nose, then automatically, if you can't process that well or things are disconnected and something's coming closer to me, your autonomic nervous system doesn't know whether that thumb is a thumb or a tiger, and it's getting closer to me. And so it's that coming close. And coming close will send this sympathetic system into fight or flight just automatically.
So the brain doesn't get the information.
Basically, it doesn't understand.
It doesn't get the correct information, or it's lumping everything into.
Yeah, it's hard to process.
I'm about to be attacked by a giant thumb. No, I mean,
what that stress is. And so that's the funny thing about the brain is that it's operating in the background all the time, and it's our frontal lobe that has our thoughts about how it's operating and what our environment's like, and what our future holds and all of that. And of course, if you don't live in the present moment, then you're probably a bit anxious about the future as well, even anticipating things, and that's this whole sort of anxiety aspect of most people's daily life. In this world. So
kind of where we're at now, especially since COVID, I would say. What's so funny, though, Dr. Deering, is they ended up waking me up because I fell asleep halfway through this process. Oh, wow. I got so relaxed.
Nice, because
you doing the exercises and imagining the willow tree.
Well, that's the power of your frontal lobe.
I guess so.
Yeah.
Wow. Okay, so we've talked a lot about me, haven't we? Was there anything else from that experience that you can recall that you could share? Because basically, I'm actually going to extrapolate from this conversation, y'all, because I'm writing my 5th book about my experience of getting through, I'm going to call it, in quotes, PTSD in a matter of 4 months, getting off of everything and doing it naturally. And, you were a key role in that. But would there be anything else? Because I know we worked on my balance as well,
Oh yeah.
where I kind of had to bend over and lift one leg. And at one point I was standing on something that made my leg unstable.
Sure.
What is the purpose of,
So yeah.
what is that exercise?
Well, so if we have a brain that basically disconnects from the body to a degree, we have a bunch of mental things that are happening, like dissociation and feeling like your head's floating or feeling heaviness or something like that. Then we know that we've had extensive disconnection. Not that anything's severed or that there's a tumor in your brainstem or anything like that, but if something's been disconnected for a long period of time, if I put my arm in a cast and I break it, after I break it, then my muscles are going to get atrophied, right? And so
Like my leg, yeah.
same thing in the brain. If we don't use it, we lose it kind of scenario. These nerves need to be constantly calibrated, I like to refer to it as. And so functional neurology is recalibrating your nervous system. So we use a bunch of tools to help your body experience all ranges of motion. Your head and neck need to have good perception and sensing of how you move forward, how you rotate right and left, looking at target. And that's vestibular therapy, essentially. We use eye movements, which is visual therapy. And then we use body movements, which is traditional rehab, but with a neurological focus. So we put you on an unstable surface that when you didn't have perfect balance would tilt right or left or forward or back. And your brain had to reconnect with your feet through your body to utilize all of your normal righting mechanisms so that your inner ear can connect with your neck and connect with your feet and the rest of your body. So we use those traditional kind of balance perturbations to be able to kind of tune up the system, if you will.
Right.
So after we got the dizziness and the big component of fear and shakiness, after we got all of that calmed down to a degree, then it's time to start using the body so that we can tune up and calibrate the whole system. And of course, continue working on the internal aspect of blood vessel health, inflammation reduction, restoring nutrients and antioxidants that get used up in large degree when you're severely stressed. So just repleting the body with the things that might have been depleted by operating at 1,000 miles a minute, trying to figure out how to stand on your feet.
That's how it felt anyway. I remember you had this shaking pad thing too that I had to stand on at one point, but I don't remember much more about it than that. It was, and there was another one too where you had me looking, or I had to hit a light. The light would come on and I had to not look at it, but see it in my peripheral vision and hit it. That was so hard, y'all. I felt like such an idiot because I would be like, oh, it's there. Oh, it's there. Oh, it's, it took me so long to I'd see it, but it felt like 1,000 years before I could get my hand over to it.
The light therapy that we used was to remap your environment around your body so that you knew where your space was, and so that targets that came in towards you or away from you weren't threatening to your nervous system and didn't wind you up, And so using those lights and movements and using your peripheral vision helps you to kind of remap all of the ranges of motion, of movement, and your ability to get to those targets. So that if I want to go pick up this coffee cup without looking at it, I'm just looking at you, I need to know where that coffee cup is so that I don't spill it on my computer, right? And that is another thing that we take for granted. But when you have an injury like you had, your nervous system gets so narrowed in on survival, then your vision and your motor maps of your environment also get narrowed. And especially if they're not stimulated and you can't pick up the coffee cup for 3 weeks because you're so dizzy and shaky, then your brain just forgets how to do that. Or it's not
exactly what happened.
Yeah.
That's exactly what happened, y'all. I would be like, cup. I've got it. Or whatever. I mean, I felt like I had won the prize when I finally was able to get through that whole mapping thing.
Yeah.
Because I know, I pestered you to death. I was like, well, how fast am I supposed to do it when I know I'm healed? You're like, well, you'll get there. You're
Yeah.
just going to be okay. I'm like, it's taking me like 8 minutes. I would only get like 5 lights in a matter of whatever the timing was. And then I had to stop the timer and then I had to start it again, and finally I was able to get through the whole thing, which was like something like 30 lights within this minute of time. And I felt like, yay, I'm winning, Just
and that is the key. That is the achievement, which builds reward and repletes our dopamine stores in our frontal lobe that, is our motivation and reward to go back and live life normally.
Right. I would come in and cry, y'all. He would be done with me and I would sleep on the table until they closed and then left. I would be there like in the beginning, you had me there 4 days a week.
Yeah.
And other than that, I slept so much. And I even had easy for me to say, I even had a hard time eating, y'all. It would be like difficult for me to chew and swallow, which that's why I thought I was losing my mind. I mean, I literally thought I was losing my mind. It started because I went to a homeopath and I've had her on the show. She's the one that found you. And, well, she had me go online first to try to to get the ear thing where you get in different positions, and it made it so much worse because I did not know what I was doing. So we finally found you. It was going to be hard for me to get in. I'm like begging. And then somebody called me back like within 24 hours and said, well, we had a cancellation. Would you like to come in? I'm like, yes, I would. Yeah. But half the time I would come in, I would just start crying, y'all, because I was so tired. I mean, here I'd gone to homeopath to feel better. And once I started getting off all the stuff that was actually suppressing all of the PTSD symptoms, I was miserable. I was like, what have I done? Why did I do this? But before, and the reason why I went, I was on migraine meds and taking Advil and drinking copious amounts of coffee just to get out of bed. I couldn't even work out. And I was like that person that loved working out, loved going for a run and all the things. So by the time I'd gotten to you, I think I was actually off of everything, but I just couldn't function. Could not function. Yep. And I don't remember getting a brain injury. I mean, it could have been the bullet that grazed my neck that could have caused that. I could have hit the ground really hard. My dad might have whacked me upside the head when I was young and I don't remember, or fallen out of a tree. Who knows?
I'm sure all of those might have existed. And
probably all of the above.
It's the accumulation of all of that stuff. And then you throw on a major stressor and trauma. And the nervous system has a hard time regulating in those types of environments. And you suppress all of that stress with medications. And those medications have side effects, especially long-term use. And it ends up affecting the nervous system in some cases.
I thought it was environmental that I was getting all these headaches, but not at all. So,
all headaches and migraines originate in your neck.
Repeat that again, please. Y'all listen carefully.
I would say almost all headaches and migraines. Just to clarify, almost all headaches and migraines originate in your neck, and medications can suppress them, but the neck problem's still there, and it can get worse over time and lead to locking down of your neck, and then next thing you know, you're dizzy or brain fogged, or any number of other neurological conditions can happen when you suppress things that are telling you it's a smoke alarm, right? If we take the batteries out of the smoke alarm by putting a medication on top of it that we don't absolutely need, if we can get to the root of the problem, then batteries out of the smoke alarm, you won't know when there's a grease fire in the kitchen if you're in the backyard.
Right. That's why I'm working out again, y'all, and believe me, the beginning of it was on the 8th week now, and I'm finally not in pain constantly from lifting weights because it had been so long, but I refuse to take anything or even put a topical because I've been injured so much working out that I was like, I want to make sure I know the warning signs. And I've learned through homeopathy and through you, thank you so much, Dr. Deering, that, take some herbs if you need them, but,
right.
Get the blood flow going. Don't try to suppress it. If you suppress it, then you could get hurt even worse, then
Yeah.
And none of us want that, y'all. You don't want that. Um, I'm very curious to know what got you so interested. You could have gone into being a medical doctor. I mean, I know that your wife is a nurse,
Yes.
um, and all of that, but what made you decide that this was your path? Was there something personal that took place, or?
Yes. Yeah.
Yes. Okay. Oh, good. Let's let's
A significant
let's
frustration.
focus on you now.
Right.
What led you to this?
Yeah, I was a young kid, 11, 12, 13, somewhere in there. I started to develop chronic sinus infections and headaches and all of that. And little did I know at that time that all of the stuff that I was into was, you know, mountain biking and four-wheeler riding and, scuffles with my brother and all of that stuff. I'd hit my head a bunch of times. And it was football. Then when I was 12 years old, it was shortly after that all this stuff got worse and became constantly chronic. In football, I had a major concussion. Somebody blindsided me, knocked me out on the field there. And when I came to, ears were ringing. I couldn't hear any of the yelling going on around me between the coach and the ref and other team or whatever. And woke up from that eventually and kind of got my bearings back within a few days and thought I was fine. Didn't think anything else about that concussion or any other head injury. But anyway, these headaches and chronic sinus infections just continued to pile up and get worse. I went to ENTs, went to everybody, took a bunch of antibiotics, almost lived on them for several years as a kid. And other anti-inflammatories and all those things that kind of wrecked my gut, and different things were popping up that weren't there before, but I still had all my stuff going on, and nobody could find the solution to the problem. Finally,
Other than more drugs?
yeah, right.
Here, take this for your stomach.
Yeah.
Take this for your pain.
Yeah. I said,
Wow.
well, why don't we get a CT scan and look at your whole head? And they found out, oh, well, you have a deviated septum. That's probably the problem. And we can go in and surgically correct that. I said, whatever you have to do.
How old were you?
By that time, I was 15. And,
oh my God. Deviated septum at
Yeah.
15. That's a major, well, I don't know if it's a major surgery, but at that time, I'm sure it was more serious than it is now.
Yeah. It's probably better these days. And back then, there was, a success rate of 50% people get better. And I said, okay, I'll take 50%.
Right.
And so I was going to sign up for the surgery, and my grandmother said, "Well, will you please go to my chiropractor? I didn't want anybody touching my neck; it hurt, and I was kind of scared of her chiropractor. But she took me in.
Says the chiropractor. Anyway,
right. She says, I think he can help with your headaches at least. Just give it a try. And so I did. First one wasn't that bad, and I kind of got over that fear of anticipating, hurting my neck or something. And, started to loosen my neck up. So this is great. And within 2 weeks, I think I'd had 3 adjustments. And within 3 adjustments, I've never had a headache again. Never had a sinus infection.
wow.
So, it was one of those.
You were sold.
Yeah. I said, well, cancel the surgery. I'm good. And I might even want to do this for my career because, I just spent 3 to 4 years running around to 5 different doctors and not finding a solution. In fact, making it a bit worse with letting it go on, taking antibiotics and all the different things. And so I was, we'll say, frustrated to say the least.
You think? I know that feeling intimately.
And so in that moment, I said, well, this could have been done 3 years ago if this was the cause of the problem. And there are lots of different factors that go into it. There's a number of other pieces that could be the source of a deviated septum or chronic sinus infection or anything else. It just happened to be in my situation that it was because my neck was twisted, and it twisted the covering of the brain attaches to the back of the sinuses. So if your neck's twisted, it's like a balloon. You'll get creases in that balloon, and you don't get great cerebral spinal fluid flow, and it doesn't wash that tissue like it should. And so it just allows things to stagnate. The immune system can't operate normally in a stagnated environment. And so unwinding my neck unwound that stagnation, and it allowed my brain and my sinuses to get the proper flow that they needed, right? Blood flow and nutrients and stimulation. And so that's what fixed it for me, and I was very
Wow.
grateful. And so I started studying and bought a book on an infomercial that was on TV at the time. That was back at the beginning of the wellness revolution. It was a book on basically organic food and plastic toxins and different things that I'd never heard of. Nobody else I knew had ever heard of. And so I started thinking about that book and trying to implement it in my life. I started getting guacamole at the Mexican restaurant because avocados are good for you, and I didn't even
Good
know
cat.
I didn't know what it was made of. So um, I just started making one little change at a time over the years, and just became more and more passionate and curious about it all. And so went to chiropractic school, studied in every different area that I could find information, and not just adjustments. We focused on rehabilitation and different rehab techniques, and I was interested in the neurology aspect of things that was being brought up at the time in chiropractic school, and so that piqued my interest. And later on, I would go into that Diplomate training and other fellowship training in acupuncture and herbal medicine. And so over my career, we just added one thing after another, and it's culminated in a dream regenerative medicine and regenerative therapy clinic. Now I operate with my wife, the nurse practitioner, who agreed to come on board and start this crazy journey of adding a bunch of different therapies and modalities to help us get to the core and the root of almost every problem that you can imagine. If we can just tune the body up and help it to operate the way it's supposed to, uh,
Yeah.
it's amazing what can happen.
The body is so amazing. And by the way, I love Lauren. She's dull. She's amazing.
It sure is.
Um, the thing about the body, y'all, I mean, it's so smart. It's so much smarter than you are. If you're getting pain, it really is, or dizziness or any symptom, it's trying to tell you something. I don't know how many people I've sent to you now. I'm like, he's a miracle worker. And what I love about you is you're so curious. I mean, you're still studying all the time, and your team now. I
Yeah,
mean, when I first walked into your office, which I don't even remember now exactly when that 2018 maybe
must have been.
must
Yeah,
have been something like that.
yeah.
And I've watched you go through different staff members and all this, and now you've got all these different aspects covered. And I remember my mom, because she was shortly after I started seeing you, my symptoms got worse before they got better. I mean, I was stuttering even more. Um, I was aware of the brain fog. I panicked a lot because I'd start crying because I'm like, I can't remember where I'm going, all the things. And I remember Celeste. Y'all have heard me talk about the Celeste, the queen, several times. And she's like, he ruined you. He messed you up. And I was like, Mom, I'm functioning in the world now. How in the world did he mess me up? So y'all had to trick her, because what happened was we had to get her hearing aids, because we'd be talking and she would hear me saying something completely different from what I was saying, and it was getting to the point where it was frustrating her, it was frustrating me. And then she developed some sort of inner ear thing where she was so dizzy she couldn't get around. We went to her doctors first, that of course wanted to put her on drugs. She took a couple of things that made her feel sick, nauseous and all this. So I tricked her. I called, I talked to your staff. I was like, I got to get my mom in. And she thought I was taking her to a different doctor. I didn't say much. I get her there. She goes, so what is this doctor for again? I said, well, it's neurological doctor. So I said, I didn't even call you chiropractor, because many years before I had taken her to one, and he put needles in her, and she was not happy. She
Mm-hmm.
was not happy. So you were so sweet with her. You looked at her and you did the thumb and all the things. Evidently, she was better than I was, because you wouldn't even do the thumb on me the first day. And I'm like, oh Lord, here it comes. You had the light therapy and everything, and you're like, now I'm just gonna put about, I don't know, 12 needles in you. That'd be okay. And then I'm gonna just adjust you a little bit. My mom was like, oh, she made me do this before and it didn't do anything for me. Blah 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 blah. And she walked out of there without needing my assistance whatsoever. I mean, your bedside manner is, I wish you could have been my dad. 'Cause imagine with your
Well,
kid.
that's funny. My little girl's birthday is today. She is 7 years old. So I will show her this recording when she's a teenager. Yeah.
That's right. This lady says she wishes I was her dad. So I want you to
Right.
remember that. Because you're just the way that because I've seen you even with kids, screaming kids coming in there and all the things.
Oh,
You're amazing. I don't know if I could have gone through this with any other chiropractor because you really knew how to get me settled,
yeah.
so to speak. Because I know I'm a lot even for me.
Yeah. Well, yeah.
Truth strikes.
No, I didn't get into this to do counseling by any means, but over the years, just to be able to operate efficiently, it is something I've learned to do. And turns out that might be one of the most important pieces to treating people
Yeah.
from a physician standpoint is to hear them, number
Yeah.
one, and then to acknowledge that, and then to walk them through a potential journey that needs to be taken. And so the guide in me is essentially just sort of guiding that person down the path towards getting them what they want. But if I'm not a good enough guide, then they're going to resist me helping them get to where they need to be because they don't trust the process. And so if you don't trust the
Well,
process, then nothing's going to work. You know?
the Queen, it took about the third visit. And then I actually heard her say on the phone to my different siblings, because they watched what I went through also, because it was happening through a holiday, and I had to tell them occasionally my arm might fly up in the air, and I might repeat myself, and sometimes this is stutter.
Yeah.
It's like I pre-warned them, and they wouldn't even look at me. They didn't. I think they didn't know how to deal with it.
Yeah.
I mean, I found that my nieces and nephews were a lot more understanding than my siblings because they're like, we've never seen you this way before. But I actually heard her talking to my siblings and saying, yeah, he's the only one that can help me. The only one. No pressure. No
Yeah,
pressure.
right. Yeah. I don't feel any pressure.
I'm just so grateful because I didn't know how in the world we were going to be able to cohabitate.
Yeah.
The hearing aids were a big help. And then she still gets car sick, but it's not nearly what we went through before. And, mornings are not the best for her.
Yeah.
But you had her doing those eye exercises too. I was like, did you do your eye exercises today? I feel like we've switched roles now.
Yeah.
I'm the mom, she's the kid.
I have a 92-year-old patient who I've seen for many, many years, and she came to me for dizziness many years ago. And I always make it a point to ask her, do you still do your eye exercises? Oh, yes, every day. And if I forget a day, then I'll feel something come in my neck or my balance. And I know to go immediately to my eye exercises and tune myself up. And I'm just like, oh,
Isn't that amazing?
It is amazing.
Because I'm the same way. If I start to get those symptoms, I have the tools to unwind myself out of it. I do find, or at least I did recently, my mom just celebrated her 90th birthday, and my family came to celebrate, most of them that could get there. And I got so wound up while they were here. And I was like, thank God I have these tools. And, they're not bad people. I'm not trying to paint a picture, that it's a lot because I'm dealing with her and with them and, a house full of people and all this stuff. But I was just so grateful that I had tools. I still exploded on them by the evening, but I got through it, and they were walking on eggshells, which was appropriate. It was what was needed. And they were so much kinder the next day. It actually worked out. But anyway, I digress.
Absolutely.
I'm still going to be me, y'all. I'm sure, all the things. Well, wow. Oh, I do want to ask you one other thing also, because I know that you went to Brazil. Did you so you went through school and then you went to Brazil to do what, basically just to study under someone for a while, or?
So it was Chile, in fact.
Oh, Chile. I'm sorry. Yeah. It was Chile.
So I really went to go and play and raft down some beautiful white water and take a trip through Patagonia. But while I was there, I had the opportunity to help a friend who was starting a second clinic. So I would help treat his patients that would kind of stop by the office, without an appointment or anything. And so I treated some of his patients, and he was a mentor of mine while we were in school before he graduated. As mentor in a sacral-occipital technique, which is basically an osteopathic types of manipulation of the cranium and the skull. And so since I was learning in chiropractic school that my problem existed because my skull was twisted and my neck was twisted, I really wanted to know, exactly how do you get deeper into something like that. And he taught me everything I needed to know about how to unwind that deviated septum and the coverings in the brain and all of that. And so I got to study technically under a mentor ship
cool.
role and go raft in Patagonia and play. So
I love nature too.
Great experience. Oh yes,
And then you were going to stay, but you went home for a friend's wedding,
uh-huh.
and
Yeah.
destiny took another turn.
That's right. That's how it happened. That's why we're here in Nashville.
Yeah, he met his wife, y'all. That's the punchline. They met at a friend's wedding, and they had this long distance phone thing going on, and he was like, "She the one for me. I reckon I won't be staying in Chile no more."
Yeah.
And I am so grateful to your wife for that because
yes,
I'm so grateful to have you in my world. Thank you so much for everything you do for so many people.
Happy to be there in the time of need.
And I hope you take care of you. In fact, this is called the Choosing Happiness podcast. So I got to ask, how in the world do you get your happy on? What do you do to maintain your happy?
Sure. Well, I have many outlets for that, but it's mostly being outside and grounding myself with, just sort of taking a mindful walk and looking at the trees and observing, all the plants and all the things happening and looking up into the sky and just sort of breathing and showing gratitude and appreciation for this opportunity to be here in the moment. So that's the fundamental way to do that amongst all the stress that life.
Yeah, I've seen you running from office to office, so I totally get it. Get it. Wow. Well, it's been such a delight to have you on the podcast. I'm so grateful that my listeners got to meet you because it took me, a year and a half to nail you down for this conversation?
Maybe.
Something like about that. And so if people were going to look for you, where would they find you?
So you can find us on social media at the Deering Clinic. And our website is thedeeringclinic.com. And you can also, find us by walking into the office and inquiring about services and all of those things. And you can give us a call. 615-721-5141 is our phone.
There you go.
So
we're going to have to write a song like 86753. Never mind. Anyway, now I've just dated myself. Very cool. I'll make sure that all the deets are underneath in show notes, y'all. And if you enjoyed this conversation, please subscribe because we get to talk to a lot of amazing people on this podcast. And if you know anyone that this could help, someone who's got these kinds of symptoms or all the things, share this conversation with them. They may not know that there is another way of looking at this, that they don't have to be taking all these drugs and live the way they are living. I mean, I didn't know. I mean, it's so funny because I'm consider myself a very holistic person. And yet I didn't, when I, had to take the migraine meds and that was the only thing that was giving me peace. I was like, oh, okay, well, that was derived from nature also. No. That was me fooling myself. So I will have a book coming out and about other ways to unwind the body and, be kind to it. So, because it's kind to you, it lets you drag it around and throw drugs in it and stuff. And not to say, I'm not knocking the drugs or the doctors. I don't want any hate mail. But anyway, there are other ways if you're curious. So thank you, Dr. Deering, for being so curious, creating such a lovely space for people to achieve wholeness. I'm certainly grateful.
Absolutely. Thank you.
You're so welcome. Hey, and until next time, y'all, signing off, the Happiness Lady saying ciao, ciao, for now. Bye.
Thank you so much for choosing happiness. If you've enjoyed this podcast, please subscribe, share, and give us a like. And if you want more happy, subscribe to the Choosing Happiness membership where you can play directly with me, Rudrani Devi, the Happiness Lady. How does it get any better than that?